Good morning, everyone. Harshita Jain is going to be presenting a research presentation to you. Over to you, Harshita.
Good morning, everyone, and Eid Mubarak to everybody celebrating. Today's presentation is a case study on preventing suicide and suicidal ideation, how to carefully explore, assess, and the techniques involved in psychological first aid. This presentation is both by me and Nafia, but since Nafia is celebrating, she won't be here today. All right, uh, moving on. Some of the things we'll be discussing today are suicidal ideation, a case study based off of it, understanding how suicides work, suicide risk assessments and risk formulation, some assessments and tools that can be utilized, psychological first aid, helpline numbers in India, and responding to crisis situations. We're all aware of what suicide is. It is the very intention of act of wanting to end one's own life. Suicidal ideations, on the other hand, also known as suicidal thoughts or ideas, are broad terms utilized to describe a range of contemplations, wishes, preoccupations, and ruminations with death and suicide. It is evident that suicidal ideations present in a waxing and waning manner, so the magnitude and characteristics of suicidal ideation fluctuate dramatically. It is critically important for healthcare professionals like us to recognize that suicidal ideation is a heterogeneous phenomenon. It varies in intensity, duration, and character. As there is no typical suicide victim, there are no typical suicidal thoughts and ideations. Here's the case study. Sarah is a 25-year-old university student studying engineering. She has been experiencing overwhelming stress due to academic pressure, relationship issues, and financial strain. Lately, Sarah has been feeling increasingly hopeless and disconnected from others. She has been isolating herself from friends and family, and her academic performance has declined significantly. Sarah's roommate notices that she has been crying frequently and has stopped attending classes altogether. One particular situation, one evening, Sarah's roommate finds her sitting alone in her room, staring blankly at the wall. Sarah confesses that she has been having thoughts of ending her own life because she feels like she's drowning in her problems and sees no way out. Her roommate's response was immediately recognizing the seriousness of the situation, taking proactive steps to support her. She listens attentively to Sarah's feelings without judgment and assures her that she is not alone. Understanding the importance of professional help, Sarah's roommate contacts the University Counseling Center to seek guidance on how to assess Sarah further. Right. Some of the factors when it comes to suicides and suicidal ideations are risk factors, which are essentially characteristics that make it more likely that an individual will consider, attempt, or die by suicide, warning signs that indicate an immediate risk of suicide, and protective factors are characteristics that make it less likely that the individuals will consider, attempt, or die by suicide. As you can see, some of the common factors are mentioned on the screen. In particular to this case study, some of the risk factors are the academic pressure. Sarah is experiencing overwhelming stress due to this. The relationship issues, which can increase the likelihood of suicidal thoughts and behaviors. And the financial difficulties, as mentioned, which can lead to feelings of desperation and hopelessness. Some of the protective factors for Sarah are the fact that she is isolating. There is a decline. Warning signs in Sarah's case are isolation, declining academics, and frequent crying. The protective factors in this particular case is the roommate support and the fact that she's willing to seek professional help. When it comes to suicide risk assessment, the very idea is to focus on identifying the risk factors and protective factors for any particular given individual. This is often followed by suicide risk formulation, which assigns a level of imminent suicide risk. The subsequent treatment plans are based off of the suicide risk formulation. Studies have shown that people who die by suicide often deny that they have suicidal ideation. Over a dozen research studies have shown that 75% of patients who die by suicide deny suicidal ideation even to the final time when they were asked by a healthcare professional. Typically, death by suicide occurred within the range of month of their last visit. Bowman found 66% denied suicidal ideation but died by suicide within days. Denial of suicidal ideation can lead to discharge, but it's a weak predictor of imminent risk and may factor in when it comes to suicide risk formulation. I've mentioned some of the screening assessments and tools that are easily available and can be utilized by mental health professionals like us. These are validated screening tools, but no single scale can accurately predict the imminent suicide risk. Clinical judgment and good interviewing skills are very, very crucial, with tools tailored to patients' age, setting, and organizational policies. Some of the screening tools for emergency are Ask Suicide Screening Questions, Manchester Self-Harm Rule, Risk of Suicide Questionnaire. Some of discharge or lessening of the imminent risk questionnaires are Columbia Suicide Severity Rating Scale, Geriatric Depression Scale, and React Self-Harm. Some additional tools that we have often heard of are Beck Hopelessness Scale, Beck Scale for Suicidal Ideation, Scale for Suicidal Ideation Worst, and PHQ. Some tools that lack validity but are often seen to be utilized are sad person scale and modified sad person scales. Like I mentioned, clinical interview is a very important imperative here, and most of us mental health professionals understand its particular value. Now we move on to psychological first aid. Psychological first aid is a supportive intervention framework designed to provide immediate practical assistance to individuals experiencing acute distress or crisis situations. It is based on principles of trauma informed care, empathy, and empowerment, with the primary goal of promoting psychological well being, enhancing coping skills, and preventing the development of more severe mental health issues following a traumatic event. The basic principles of PFA are safety, calming, connection, and self efficacy. Safety, this principle emphasizes the importance of ensuring physical and emotional safety for the individual experiencing distress. It involves creating a safe environment where the person feels secure and supported. It also may include removing immediate threats, providing a reassurance, and offering a sense of stability during crisis situation. Calming involves helping the individual manage their emotional distress and regain a sense of emotional equilibrium. This can be achieved through techniques such as deep breathing exercises, guided imagery, or grounding techniques that can help the individual feel more grounded and centered in the present moment. Connection focuses on establishing a supportive and empathetic bond with the individual. It involves active listening, showing empathy, providing non judgmental support to help the person feel understood and valued. Building a connection can reduce feelings of isolation and foster a sense of belonging, which are essential for recovery and resilience. When it comes to self efficacy, it refers to the individual's belief in their own particular ability to cope with challenges and overcome adversity. This principle emphasizes empowering the person to take an active role in their own recovery by identifying their own strengths, resources, and coping strategies. Particularly, here, some of the techniques that we can utilize are active listening, safety planning, crisis intervention, validation and normalization, psychoeducation, coping skills training, strengths based approach, referral to a professional help, follow up and support, and collaboration and involvement. Right. When it comes to the case study we were discussing earlier, let's try to fit in the principles of PFA there. When it comes to safety, Sarah's roommate recognizes the need to ensure Sarah's safety as a priority. She creates a safe and non-judgmental environment for Sarah to explore and express her feelings by listening attentively and reassuring her that she is not alone. Sarah's roommate also practices calming techniques by maintaining a composed demeanor and offering reassurance to Sarah. Her roommate establishes a supportive connection with her by actively listening to her concerns, validating her feelings, and expressing empathy. Sarah's roommate empowers her by taking proactive steps to take professional help, which allows her to build self efficacy. I'll now be presenting some helpline numbers which are present in India. These are all working at the moment. I have also mentioned the particular ailments they deal with. So some of these are 24/7 helpline numbers, while the rest may only be applicable from 10 to 7:30 p.m. or 11 to 9. I would be sharing this with the on the important comms group as is. Perfect. Moving on, responding to crisis situations. So these are certain factors that we could take in mind when we are responding to situations like this. First off, start with establishing safety, active listening, de-escalation, exploration of the underlying reasons, offering the client and individual support, crisis intervention, which involves problem solving, coping skills training, and exploring available resources, collaborative planning, where we increase their self-efficacy and identify strategies for managing future crises, and referral and follow-up. We're all aware of how important early intervention is. It leads to swift action, can lead to helping prevent harm to the individual in crisis or others involved. Timely intervention can reduce the risk of self harm, violence, or escalation of the crisis. Early intervention increases the likelihood of successful outcomes and promotes faster recovery from the crisis. It provides the individual with support and resources they need to cope with their difficulties effectively. Prompt assistance can also help mitigate the psychological impact of the crisis on the individual and minimize long term trauma. Timely intervention demonstrates care and concern, which can have a positive effect on the individual's well being. I would, we would all um, I'm sure the clients would appreciate if we encourage them to constantly seek help from professionals like us because it is essential in promoting their mental health awareness and destigmatizing help seeking behaviors. By offering support and reassurance, we can empower these individuals to reach out for assistance when they are facing challenges or experiencing distress. All right, I have a few questions for all of us. How can I assess someone's risk of suicide? A. Ask direct questions about suicidal thoughts, intent, and plans. B. Evaluate their access to means, history of attempts, and current level of distress. C. Use validated screening tools. D. All of the above. All right, thank you so much for your responses. In the case study, which of these is incorrect usage of the PFA principles? Sarah's roommate ensures that Sarah is in a safe environment and removes any potential means of self harm for her vicinity. She speaks to Sarah in a calm and reassuring manner, encouraging her to take deep breaths and focus on the present moment. Sarah's roommate tells her she does not understand her feelings, severing their emotional connection. She empowers Sarah by emphasizing their strengths and reminding her of past challenges she has overcome successfully. Absolutely. Thank you guys for your answers and for participating. I'll now be ending this presentation. Thank you for being here.
Um, thank you so much for that presentation. Let's get some feedback. Can we have feedback from Mello? Thank you. Shikha Sharma, what would you like to add? Okay, let's move on. Tanya, any feedback from you?
All good, sir. It was very interesting.
Okay. Shubhika, anything you'd like to ask or a comment? Yep. Okay. Thank you very much for that presentation. So let's move on with our next agenda item.